Well, today is National Post-Traumatic Stress Disorder Awareness Day, which recognizes the effect it has on people living with PTSD. KNWA Today's Kirika Azuka live in studio with what's been learned about the disorder over the past several years. And Kirika, good morning.
Well, good morning, Chris. I spoke to two professionals who tell me even though veterans come to mind when talking about PTSD, it can really affect anyone.
I think a lot of people have post-traumatic stress because most people have some type of traumatic incident in their life.
But emergency room physician Dr. James Holden says not everyone necessarily has post-traumatic stress disorder, which can look different in different people.
There's inability to sleep, inability to function at your work, problems with relationships, even addiction.
The American Psychiatric Association says about 3.5% of U.S. adults suffer from PTSD. That diagnosis used to be reserved for combat war veterans, but Dr. Holden says that's changed over the years, especially for people working high-stress jobs.
Sometimes you can't save their life. Sometimes there's not a good outcome with that. And that weighs heavily on physicians and nurses in the emergency department. You know, what could we have done differently?
Something Jessica Davis at the Peace at Home Family Shelter knows all too well.
Secondhand trauma is definitely something that service workers feel a lot.
Davis works with men and women trying to escape abusive situations.
With domestic violence, there's a million reasons why someone would stay in that relationship.
She says she deals with dozens of people experiencing post-traumatic stress, which could potentially turn into a disorder. Some days are so hard that she has to use techniques she teaches clients on herself to keep stress at bay.
I have to practice mindfulness too, and so when I go home and leave work, I'm actually there at my house and my mind's not still at work.
Dr. Holden says there's still a stigma when people talk about mental health, but it's important to seek help if you need it.
If you have chest pain, you go see a heart doctor. If you have kidney problems, you see a kidney doctor. If you have diabetes, you see a specialist. Mental health disorders are no different.
Now, on this PTSD Awareness Day, you're encouraged to reach out to someone who may be affected by the disorder. Let them know you care and are there to help. Live in studio, Kirika Azuka, KNWA Today, Northwest Arkansas News.